Thank you, Mr. Chair. I'm going to change direction a little bit. I was looking at the bill sponsor's amendment compared to this amendment, and I don't think it does, in all due respect, kind of what we believe needs to be done. And I've brought a bill before to protect children from puberty blockers, and so I just want to speak to you from a different tone and a different perspective as a healthcare worker who has vaccinated my children. I think I've told you guys the story and never been opposed to vaccinations, and then started to do a little bit of digging because I wasn't getting informed consent about vaccinations. And then I started doing a little bit more digging and thought, why am I not getting informed consent? And so when I started to become a legislator, I started doing a little bit more digging into what we call gender affirming care. So as a mom and a child abuse survivor, and it being Child Abuse Month, I find it very interesting that this bill is definitely coming forward, because I don't think that parents and children understand the harmful rhetoric and the false narratives being pushed on them. And that's where I want to come from a place, from a good place, a good heart. Instead of the rhetoric that our caucus has been blamed for, we get called a lot of really bad names and a lot of ugly things. And I think, wow, I'm just trying to protect kids, and I try to say these things. The minority leader brought a bill forward in Health and Human Services, and I have a very big standard when it comes to passing bills. Does it go through random control trials? Are there double-blind studies? All the things that I've been taught in physical therapy school to look for. And so when I started down this rabbit hole, I started looking at what are these kids and these parents being told? Because I want to know that they're getting informed consent, because I don't even get informed consent with an MMR vaccination. So are these parents being sold a suicide lie? Are they being sat down and told after puberty, children will go back to their biological sex? Are they being told the statistical evidence? And I don't believe that they are. And so that's where I'm coming from, a place in my heart, and that's why I run these bills. So I started looking at the data. 90 million patients in one study involving 56 United States healthcare organizations, 90 million patients. And what did they find? They found that individuals who underwent gender-affirming surgery had a 12-fold higher suicide attempt risk than those who did not. 12 times. Okay, let's continue. Another study covering a period of 30 years showed 19 times higher suicide risk for people who had undergone gender-affirming surgery. So when we talk about harmful research and harmful things being done, we have to also talk about what is actually happening. So this one showed not just 12 times, but this one showed 19 times. There's a reason that most countries have either said, caution, we need these kids to go through psychological counseling before we even start this process, or we're going to ban it outright. And a ton of doctors have already said we're not going to do this anymore because we feel like we're doing harm. So when we talk about conversion therapy being harmful, we need to talk about the alternative risks to our children as well. There's never been a random control trial of puberty blockers and gender dysphoria. That was what I just told you. That's the gold standard in medicine. Multiple systematic reviews of the data does not show safety nor that they help. That is the science. That is what we're being told. It's not safe. Major studies on children in the UK and US did not find that blockers helped nor were safe. Blockers are not FDA approved for gender dysphoria. The most famous study saying regret rates for gender surgery are low. Ages 13 plus did not have data on 30 to 40% of their patients. Regretful patients are less likely to follow up. According to the DSM, 61 to 98% of boys and 50 to 88% of girls desist by adulthood. For the many cases of gender dysphoria which desist by adulthood, youth presumably get risks but not benefits. Suicide mortality is not predicted by gender dysphoria. We just said 19 times more likely to commit suicide. So I don't understand why we're pushing this on our children. And this amendment would say that we can't. I am worried about the children of Colorado. The bill sponsors are worried about conversion therapy. I'm worried about treating our children like beagles with fleas. I'm at a loss. Every country has researched this, and they are saying stop, pause. The U.S. has studies that they have hidden because of damning evidence to our children that we're supposed to do no harm. The most vulnerable, we're supposed to do no harm. 6 independent systematic reviews in the UK, 2 in Canada, 5 in Johns Hopkins. 3 different countries have said puberty blockers are not safe for minors. UK and Canada have no evidence that it helps or is safe. So why wouldn't we accept this amendment? What is the gold standard?